46 on the Central Coast CW.
Good evening. Our top story tonight as the COVID vaccine rolls out, and it continues to roll out across the Central Coast. Many local-owned pharmacies are wondering when they're going to get to take part in the effort to get people vaccinated. Thanks for being here at 10 for the CW. I'm Veronica Macias. Our KION's Josh Cristianto found a small family pharmacy who says they have everything they need to vaccinate people. And even if it's on a smaller scale, they say this is going to help. Josh?
Well, that's right, Veronica. They're really waiting on the go-ahead from the federal government as well as for the vaccine supply to increase. But with that new COVID vaccine from Johnson & Johnson that is easier to store and administer, we could be seeing a new chapter in the fight against this pandemic. Entering into nearly a year after the first COVID-19 shutdown began across California, new concerns over another surge in March. Even with vaccinations rolling out, new variants of the coronavirus threaten to curtail the progress we've made.
Despite vaccination happening as quickly as we get the vaccine supply, it's likely not going to be quick enough to cope with the newly more transmissible variants.
Some good news, though. A third COVID vaccine could be on the way from Johnson & Johnson. The company has now requested emergency use authorization for their doses. Local officials are suggesting it could be a game changer to the rollout effort.
It's a fairly inexpensive vaccine. But perhaps more importantly is that it's a single dose and it's much easier to store.
I think had the state allowed us to do it and given it to us, we could have got it done to our facilities, to our patients, and set up vaccination sites. Yes, we totally could have done it.
Locally owned pharmacies in Santa Cruz County are bemoaning the fact they've been forgotten in the rollout effort, while state and federal officials are focusing on bigger chain pharmacies like CVS and Walgreens. Smaller ones say they've got what it takes to help.
We're independent. We have the staff. We have the capabilities. We do injections here as it is.
She says because vaccine supply is under federal guidelines right now, they won't give any doses to independent pharmacies until it falls back to state guidelines that allows wholesalers to carry the vaccines. There are around 5 locally owned pharmacies in the Santa Cruz area. They could make a difference.
I know back east they gave injections to a local pharmacy and they got almost their whole town done.
And Veronica, if things continue the way they do, Santa Cruz County health officials are expecting a surge in late March with hospitalizations and deaths increasing in April. Reporting live in Santa Cruz, Josh Cristianto, KION News Channel 546.